we go ahead and get rolling? I don't have a huge agenda today, but we always seem to fill the void. So we will get started and then folks can jump in, ask questions as they come up. I've already had a few folks reach out. I'll go ahead and preface the discussion. There has been some question about, as best I can ascertain, mainly issues around the state pod. So two issues that keep coming up. Number one, the fairground seems to be by far the most common. People are getting to the fairgrounds because they're scheduling appointments, and the fairgrounds is turning them away because they do not have proof of chronic illness. That, again, on the same token, there are others who say they will ask you for proof, but they will not turn you away if you self-attest. So, I would still say it is probably safest, because I have definitely heard that some people say, despite best intentions, they still get turned away, or they get a call saying, I'm here, I have to have the letter from you faxed in the next 38 milliseconds, or they will not give me my vaccine today, and I have to start this whole process over. And so everybody's business comes to a grinding halt because they're trying to get people what they need to get the vaccine. So, I realize, unfortunately, not every patient is reaching out to you beforehand to let you know, nor do you probably want them reaching out to you beforehand, because that would grind your office to a halt for a whole different reason. But it does seem to be, depending on who they come face to face with at the fairgrounds pod in particular, that has been an issue. Likewise, I've now heard it from two folks that if a fairgrounds second vaccine needs to be rescheduled for any reason, that seems to pose issues. That one, I'm actually reaching out through Vinny Esposito, who obviously has a direct line to the governor's office. That should not be an issue. That has never been brought up before, but for whatever reason, it's now been two people. So it seems that that's enough to create a consensus that it's a thing. So that one I'll try to get back to you on if you're noticing that's becoming more of an issue, but that should not be a problem. And I do see, Liz that's sending the letter to attest. That is probably the safest, but it does require a lot of work. I readily concede to send those letters out to everybody. So I just want to put those two out there because there has been a flurry of folks reaching out about those. I wish I could say that we had any special power, especially outside of the 9-county Finger Lakes area. We don't, but we try as best we can to use the various representatives on the Finger Lakes Task Force to reach into these other areas to see if we can't restore some order to the universe, but not always successfully, as you have all learned so far.
Oh, sure.
So with that, as far as our current State of the Union, case rates continue to drop. So that is good. You will see on the data from today, we continue to bump around. We're not decelerating at as rapid a pace as we were maybe a week or so ago, but we are still decelerating, certainly a number of new cases per day. If you look at percent of patients who are positive who were tested, you'll also see that in New York, we have now topped 40 million folks who have been tested. That is significant because there are just under 20 million New Yorkers. So we've now done enough tests to where every man, woman, and child in New York has been tested twice by law of averages. So that's fun news. The mortality statistics, as you can see, have bumped up a little bit as far as number. You can see we had a few more cases than we did the last couple of weeks in New York. There's concern, is that due to variants? It's hard to say at this point. Fortunately, in Western New York, we have not seen any of the UK and South American variant that is of so much concern, at least in the Rochester or U of R lab. We have seen other variants, but none that are of the more contractable flavor, I guess, for lack of it, are the ones that are most concerning to folks at the moment. Certainly in the downstate area, they have seen the variants, although I continue to understand that the only place in the country that has seen all 8 of the known variants is Texas, who is also, as we talked about last week, the area that has the least amount of restrictions at this moment. So go figure. So, the variants are there for whatever reason. They have not penetrated as much into Western New York, which certainly is a good thing, but I don't know if that'll stay that way forever. I can't say that the number of new cases is totally attributable to that, but we're continuing to progress overall in a good direction, both locally, statewide, and federally for that purpose. Hospital occupancy continues to go down at a very quick rate. Notably, as of Monday, I think Strong is the only hospital that I'm aware of in the local Finger Lakes region that has not gone back to full ambulatory surgical volume as in pre-pandemic volumes. Strong is at 95%, and Monday they will be fully open to pandemic or pre-pandemic volumes. So that's impressive. Also notable, tomorrow is the 1-year anniversary of the first positive test in the Finger Lakes region. So the first positive test came out of a patient who presented to the ED at Highland on March 11th. Then Highland Hospital actually had the first admission, which was a different person, on March 12th. So we are at the 1-year anniversary definitively for Finger Lakes in the region. God knows we're in a better place than we were, but still not in a wondrous place at this moment. But certainly things seem to be calming. One of the biggest concerns is, we're starting to remove restrictions at a fairly good clip. So, the amount of congregational gathering has been allowed to increase. Everyone is probably aware that the CDC has released their guidelines saying that fully vaccinated people can gather in small groups unmasked, which was to the resounding cheer of most, but has already been met with some backlash of, but should they? So, I think it's a hard question. I think it was the New York Times this past weekend that had a really good editorial from an infectious disease physician who made a very valiant case that never in the course of preventable disease have we said that we have a vaccine, but then do not allow for the vaccinated to get together. So smallpox for chickenpox. If you had your chickenpox vaccine, you allow those kids to play together. You don't keep them separate. But that is, we're still somewhat hesitant, all for very good reasons around COVID. Nonetheless, I think, more and more the true data is arguing better and better that that probably is a reasonable thing to consider. So take that for what it's worth. I also heard a statistic yesterday that it is currently more likely that you will die in a car accident than it is that you will be hospitalized for severe COVID or die from COVID. So that also frames things tremendously. We get in cars every day and don't think a thing about it. And unfortunately, I know Renee, drive at probably higher than acceptable rates of speed, and still I'm not wearing helmets and doing anything especially exciting to prevent that. So, I think it's a reasonable frame of reference, but we've certainly fought awfully hard to get to this point. It's been a hell of a year for a lot of folks, including everybody on this call. So, I think an ounce of caution is warranted, but there definitely does seem to be a brighter and brighter light at the end of the tunnel. That's true. Renee's chance of COVID is still lower. Anyone who's ridden with her will say that that's true. So that's where we stand with the numbers. The graphics, really just showing the plateauing effects or complete decelerating effects of hospitalization and cases. But clearly we're seeing the plateauing of mortality, of new case rates. So things are definitely looking to be in a pretty good spot. Again, once we get lower than that, 10% is bad, 5% of those tested positive is where you do not have widespread community spread, and 3% is where you're basically controlled. So in Monroe County and most of the surrounding area, we are in a controlled percent of positive. If you look at New York and nationally, we are still not in that sub 5% threshold. So there clearly is still community spread ongoing. But obviously we'll continue to follow that, and it probably is going to take a while before we get to less than 5% positivity. Certainly the warmer weather doesn't hurt though. And we're already seeing in other parts of the country where it's warmer, people theoretically are getting out. They're less congregate than they were before, being in colder weather and indoors more. So the hope is that we will see that the effects of the vaccine superimposed on the effects of the warmer weather and better ventilation and people being more spread apart if the gods are with us. So with that, I'll go ahead and, actually we should launch into the community numbers. Yes, 24 hours. So we're doing there. But really the fascinoma that we're seeing in Monroe County is true across the region. This obviously comes from our friends at Tri-County. Everybody is doing better. Some are obviously doing much better. And as we'll talk about vaccination wise, we're still seeing a steady lag from Steuben and Allegheny County, both in percent of population that is vaccinated, but also in volume of vaccine that is reaching those areas. So we have seen some rays of hope of more vaccine getting into those regions, but it's still going to be a lot of catch up, and there's still more vaccine hesitancy in those regions than we're even seeing locally. So to date, I think it's something like 22% of all adults in Monroe County have been vaccinated. That's actually quite good when you look across the rest of the country. If you kind of go into the more Wyoming, Ontario, you get down into the teens as far as percent of vaccination. And then when you get down to Steuben and Allegheny, I think Allegheny is still sub 10%, but almost at 10% at this point, if I'm not mistaken. So you can see there's definitely the haves and have-nots at this moment. Nationwide, as of yesterday, there were 61 million Americans who have received at least one dose of the vaccine. We have about 350 million Americans, so we're basically at about 1 in 6 folks across the country who have gotten at least one dose. Now, what percentage of those will actually be willing to receive a vaccine? Obviously, it's not going to be the full 350 million folks, but we are definitely moving in a good direction as far as getting vaccines into arms, especially as vaccine availability is accelerated. That should continue. So locally, we have this week so far and next week anticipate a slightly lower amount of vaccine than what we received last week. Very slightly. I think it's like 97% of the amount of vaccine. Last week was a big bump. So we're still seeing quite a bit. We still, at current trajectory of vaccine in arms and vaccine availability, which we anticipate further acceleration as we get closer into the May timeline. But we still anticipate 80% of all 18 and over in the Finger Lakes region should be able to be vaccinated by June, which puts us on a better timeline than even the rest of the country at this point. So that's good news. As far as where is it not good as far as vaccination in the country, unfortunately, it's probably the places that you may actually want to go on vacation. So Hawaii is still leading the way. Georgia is still, I think, the worst at this point. I think Mississippi has gone pretty close, if maybe not overtaken Georgia. Not that necessarily Mississippi is your primary vacation destination. Florida is actually still doing okay at the moment, but really the Sun Belt states are still lagging to a large degree. So we'll see how that goes in the coming months for sure. Just this today, I believe, Alaska has now opened up vaccination to anybody 16 and over across the entire country. I think there are now 3 states that are doing anybody 16 and over without stipulation. Everyone probably knows the governor yesterday reduced to 60 and over from 65 and over. So we're still 18 and over with chronic disease, or now anyone 60 and over without stipulation. It had got to the point that we were starting to see a decrease in the number of 65-year-olds who were available for vaccination, either because they were refusing or when the calls were made and folks were reaching out to them, they had already been vaccinated. So there was some concern that with that 65, we would actually maybe not be able to utilize the vaccine as efficiently. So they dropped it to, okay, 16 and over comorbidities. Sorry, I think I said chronic disease, but yes, that's correct. Or maybe I said something else. I did. Okay, so
you said 18 and over.
Oh, sorry. Well, I got excited. Who cares about 16 and 17-year-olds? They're terrible. That's a terrible age. So there you go. See, now LJ's upset. That's my goal here. If I can upset one person, it has to start with LJ. And probably there's 100 other pediatricians that are on black screen that are really mad right now. But if you're on black screen, you don't get to complain. That's the way the rules are. So there you go. So yeah, 16 and over with comorbidities, 60 and over without stipulation. That's the rule. So vaccine is coming. As I said before, there is effort from Golisano at really working to identify and get 16 and 17-year-olds to vaccine. There has been significant effort across the hospital, even including in pediatrics, to try to vaccinate those who are hospitalized. That has proven more difficult than what we otherwise anticipated. So the issues that we have, the average length of hospitalization is 4.4 days. In that 4.4 days, you have to identify that the patient meets criteria, you have to consent them, and then you have to time getting the vaccine. And that's been a little bit more difficult than what we anticipated previously. So they are still working out the kinks to that. Yes, that is true. Working out the kinks to getting vaccine into the hospitalized individuals. They are primarily using the J&J vaccine for that group. But certainly in the smaller hospitals, it's even more of a challenge because one, they're not getting as much J&J. Two, when they crack open a vial, they need to make sure that they can get 5 to 10 of the vaccine in. So making sure that they time that appropriately to get the vaccine and folks who are going to be discharged is obviously a consideration. So long way of saying there's lots of different efforts going on right now. Just so that you know, we do have, Renee has been working very mightily with the team at the U of R to convey all the 65 and older from our community practices who need vaccine. We are meeting tomorrow with the team from the U of R to see about sharing lists from Arcadia of anyone who meets the 16 and over comorbidity criteria so that they can start utilizing that to get those folks in more efficiently. So, obviously people are trying to call on their own, they still should, but we're trying to get as much vaccine out as quickly as possible to all possible parties. So more to come on that. One thing, and I think Lucia's on, I see the backdrop. There is a meeting, it's of private practice representatives who are looking to advocate with the Finger Lakes Task Force and other representatives about getting vaccine distribution to the private practices. I believe that's coming up Monday or Tuesday. Lucia, do you want to comment?
Sure. Actually, so the private practice physician group is meeting with Drs. Bennett and Mendoza tomorrow from 5:30 to 7. And Drs. Mendoza and Bennett will be speaking to that particular group from 5:30 to 6. We have met, and the whole idea is to try to really get the message across that there are multiple private practitioners who are ready, able, and willing and registered to administer the vaccine once it comes. So it's an open conversation about why that hasn't happened yet, and what's to come, and how can they continue to best prepare themselves. If anyone's interested in being a part of that conversation, let me know and I'll forward that invitation to you.
Perfect.
Lucia, could I just add to that for a moment? I think that you're aware that there's a concerted effort on this from our Buffalo colleagues, and there is a letter that we already have drafted and ready to be able to go to the state assembly and the state senate and leadership. So if we can piggyback right on the back of that meeting, I know Dr. Mendoza is very supportive of this already. And as is Pat Brophy as chair of the Department of Pediatrics, I think that we want to support our primary care practices to be able to do what they do best. And it is best for children to receive these vaccines in their medical home, and with people who know how to do vaccination for kids and do mass vaccines every single year with flu vaccines. So anything, the letter is all set. In fact, we have an email ready to go out to all the providers. I was going to mention that today, but we'll do it right and wait till after your meeting tomorrow. That would be great.
That would be perfect timing. And I think I saw that came through, but I'd definitely like to see the final, obviously, because I have the AAP hat on as well. So,
Perfect.
yeah, perfect. Thank you.
And I know that, there's been a lot of discussions with Vinny Esposito, who I said before has the ear of the governor. So there seems to be a lot of support, a lot of traction. It just hasn't rippled down from the blessing from the governor's office and Department of Health to make that happen. But I think we're pretty close at this point. So the more advocacy, the better, and the more voices, the louder. So yeah, I think that's a good thing. So more to come on that one. And thank you, Lucia, for chiming in with that. That was lovely. And I think with that, I have covered my list. So LJ, anything you would like to?
Actually, I was just going to speak about that topic, which is great. We've already covered it. And just a reminder to all of the clinical providers who care for pediatric patients and adolescent patients, the revision to the return to play guidance is complete. It just got posted on the Galsano Children's website. I mentioned this in our last meeting, but this was, the documents were worked on between the Western New York team and the Finger Lakes team. The major revisions are in the algorithm and in the return to play assessment form and release form. They are not dramatic. If anything, they make it more reasonable in terms of fewer kids landing in the moderate bucket of symptoms and fewer kids being unnecessarily referred to cardiology, an opportunity to kind of hone in on this. So just a little later this afternoon, you will get an email that summarizes those changes. We'll be sending out. If you have questions, feel free to reach back out. Liz Walsh has kindly offered to update for the Medent users, the assessment and release template in Medent. And again, all of this revision to the guidance came out from the AHP on March 1st. It took us a little while to tease out all of the slight nuance changes. But we've summarized it for you, so you don't have to go and look at this document and figure out like, what the heck happened here? Anyway, I think it doesn't change one piece of workflow for the schools. And I think that's important. It really should just allow you to utilize clinical judgment even a little more, and yet still make sure that these kids are getting assessment. And again, I think the key message that I took away from the AHP interim guidance is what they really want is for caregivers and parents and youth to understand the importance of paying attention to concerning cardiac symptoms should they occur post-COVID, and understanding what those are, not just in the immediate period post-COVID, but in the month or two afterwards where you might see MIS-C develop. That's it.
Beautiful. Renee, anything you have?
Nothing for me, other than we've got, I guess I do have one thing, PPE next week. The survey has already gone out. Please make sure you complete your survey. And that's it for me.
And next week, we can say definitively will be the massive load coming out at you. So don't be surprised if you see lots of minions and hand trucks and big boxes coming your way. So please do not show up in your favorite Mini Cooper. Because that will require strapping down and lots of stuff. So come in the biggest car that you possibly have, so we can give you stuff to go away with. Okay, I think the chat room is clear. So if anybody has any questions, feel free to chime in or anything else we missed. Otherwise, I think that runs it. Not seeing anything right now. Nobody's, our greater than 65 can still expect a call. Yes, so they're going down the list. They're trying to be as equitable as possible and randomizing widely. It will be over 60 now, so they are loosening that threshold, and they just got approval to be able to utilize the vaccine for the 16 and over with comorbidities if they can't schedule people for the 60 and over. So they have to focus on the 60 and over. They're still not getting as much vaccine, although this week they got a reasonably good bit. And they got approval to be able to go ahead and secondarily extend that to the 16 and over category as well. So they will continue to do that and reach out to folks. I'd say, I don't think they've fully started reaching, well, I know they haven't fully started reaching out to the 16 and over yet, just because they've not had enough vaccine to even get through the 65 and older. But with the word yesterday from the governor's office giving them approval, now they will be reaching out to the 16 and over crowd to get them in.
And Pat, there has been, or Pat, good Lord, I'm calling you Pat Shad, sorry. There has been outreach from Galveston Children's directly to any patients who come there for their specialty care. So identifying that patients would qualify for vaccine. Even though they're not getting the call to schedule the appointment, they've at least been alerted and how they can schedule.
Perfect. And so, yes, so everyone still should be getting those calls. And then obviously that does not preclude them from being able to reach out and get it through pharmacies, health department, state pod. So all those remain on the table. And as we said last week, and it actually made it to the editorial page of the newspaper this past weekend, continue to remind people that when they log on to the state site and it says no appointments available, it is still worth clicking to that next level, because appointments pop up and then they disappear in seconds. So even though it'll say no appointments available, that is not true. Exactly, just that fast. So it is worth clicking down to that, each one of those sites and seeing if there are true appointments there. And they're getting loaded at random times as people cancel or slots get added. So it's worth checking back quite frequently for that. Okay, I think we have run the list. Everyone can have 17 minutes of their life back and enjoy the warm weather. And we will see you next Wednesday morning for PPE distribution, and then next Wednesday back here. Have a good one, everybody. Take care. Bye-bye.